Welcome everybody to the weekly Crisis Jam. It is wonderful to have you here today. I'm Lindsey Browning. Some of you may have seen me before when I've had the pleasure of hosting these calls, but glad to be back. I am the Director of Medicaid Programming at the National Association of Medicaid Directors, and thrilled to be here as your host today for the conversation. And as I mentioned a few minutes ago, it was great to see many of you in person at the NASHPID meeting earlier this week. Today's conversation is going to feature a featured presentation by Gabriella Wong from accesSOS, but we, as always, have lots of other great content to get to as well. Next slide, please. As always, we like to highlight the incredible and growing participation we have in this community here, focused on building out crisis services and realizing the vision, delivering on the vision of 988. So we have 67 national organizations that are participating in the Crisis Jam calls. And you can see on the right side of this slide our record number of participants in that launch call the other week, with 723 people either participating live in the Zoom or viewing the recording of the conversation. So we are a growing community, and we are a strong community focused on building out crisis services. As always, you can visit the Crisis Talk website to access any of the resources or materials that are shared in this learning community. So sign up there, be sure to visit the website, save it as a favorite on your browser, because there's lots of great content there. We also wanted to flag this press release from the FCC around the transition to 988. In case you guys didn't see this, but in particular want to call attention to the fact that the press release highlights the effort to continue to make 988 accessible to all individuals, including the additional rules that were adopted in November 2021 to expand access by establishing text messaging for 988, which I know is a key area of interest and focus for many on this call in the lead up to that announcement. So just want to make sure folks have seen that. Our quote of the week is from Andrew Brown, who's the Commissioner of Behavioral Health Services in Kansas. And the quote is that 988 is for everyone. If 988 is for everyone, Kansas has to think about IDD for mobile crisis teams. And this quote speaks to something we've been talking about a lot in the Medicaid world as well, which is making sure that the crisis continuum really reflects and responds to the needs of all individuals, including those who have more unique or specialized needs as well. So, next slide, please. All right, well, let's move into our featured presentation, and it is my distinct honor to introduce Gabriella Wong, who is the founder of accesSOS. Gabriella is an incredible thought leader, entrepreneur, and individual with lived experience, who's here to share a little bit about the work that she's leading at accesSOS and how it can support and help deliver on our shared goal of making sure that crisis services are accessible to all individuals. So Gabriella, I'll turn it over to you.
Lindsey, thank you so much for the great introduction. And I'm just so thrilled to be here. I've tuned into this Crisis Jam many, many weeks, and just so thrilled to just be featured on this. So as Lindsey has mentioned, I'm Gabriella Wong. I'm the founder and executive director of accesSOS. We are a tech nonprofit, and our mission is to make emergency help accessible and equitable for all. Next slide. So this is a photo of my family, and I know you can't tell from this photo, but both my parents are deaf. We communicate using American Sign Language, or we tend to text each other. A few years ago, when my father was home alone, his gallbladder ruptured. As a deaf man, he was not able to call 911 for help. He texted me to call 911 for him, but I wasn't near my phone at that time. As his daughter, this really affected me. Next slide. My thought was, why couldn't my dad text 911 directly? And some of us already know that in many American cities, you can't text 911. I want you to imagine that there are 37 million Americans like my parents that can't call 911 in an emergency. Next slide. 70% of 911 call centers can't receive texts. It's because of aging legacy technology. And the soonest the United States could get 100% access might be 2030. People like my parents can't wait that long to get the help they need. Next slide. So many communities are left out of emergency services. People with disabilities aren't the only ones that lack access. I want you to think of all the people, non-English speakers, domestic violence survivors could all benefit from accessible emergency services. And next slide. And that's why we started accesSOS. Using the best solutions, we built a free mobile web app. It's an accessible user interface, and we get your emergency location, and in a few clicks, we translate text to a 911 call that's fast and quickly contacts your local 911 call center. The next slide. accesSOS uses your language preference. And next slide. And our app was recently launched in Santa Fe, New Mexico. One person that downloaded our app said, "This is so helpful for domestic violence since you don't have to use your voice to get help." Our app covers a population of 89,000 people, and to date, our advocacy efforts have impacted 15,000 lives. And next slide. We were so excited that our app was launched, but when we talk with more of our deaf community members about using our app, the thought of using our technology right now and police arriving to the situation where they can't communicate with armed law enforcement scares them. We asked a deaf Black man, "What would you do if the police didn't know you were deaf?" He didn't know. He pointed to his ears and signed, "I hope that never happens." Next slide. The problem expands further than accessibility for people who are deaf or hard of hearing. What happens if you're deaf and you're having a mental health emergency and police consider you a threat based on how you look? Imagine being handcuffed, but your only form of communication is through your hands. How do we address inequality and emergency response for those with intersectional identities? And how do we include key information to avoid unnecessary escalation? Next slide. 80% or more of 911 calls don't require a police response. And 48 million people in the US called 911 in 2021 for mental health related crisis. Next slide. In recognizing this problem, us at accesSOS, we realize we have a great opportunity to improve our app. What options are available for alternatives to police response? How can we unbundle policing? People don't want to make decisions about where their emergency should be routed, and they often don't know which resources are available. From interviews with first responders and crisis intervention specialists, we discovered that these issues were already well known in the mental health community. With 988 launching, people can call or text 988 regarding mental health emergencies and will get help from professionals who've been trained with behavioral and mental health training. This led us to incorporate routing 988 in our future direction. The new iteration of the app will also route to additional numbers like 211 and 311, which addresses non-emergency situations like finding housing for anyone experiencing homelessness. Next slide. We redesigned the original accesSOS app to ask the user what type of emergency they're experiencing, instead of asking which type of emergency services should respond to their emergency. And we included a category for crisis. This ensures the right type of first responder is sent based on your type of emergency. Our app will also include key information to avoid unnecessary escalation that could result in someone getting hurt. The next slide. And as you see here, our design helps guide users to getting mental health support. If a weapon is involved, the call does go to 911. But if there are no weapons and it's not life-threatening, it's directed to 988. We've incorporated this automatic routing within our app design. We've also designed categories, icons, and specific names for the most common emergencies, and we created categories that are easier to de-escalate. Next slide. Now, I want to discuss 988 and emergency location. In a Help Not Handcuffs call last week, I learned of a story from a NAMI facilitator. And here's the quote. Myself and 2 other NAMI facilitators had a situation this past Sunday where a fellow facilitator in another state was in crisis. While my partners were trying to contact the other state's 911, I called the new 988 number. It did work. However, there were several messages and transfers. I know this is a new line, but a person in crisis who is suicidal may not have the capacity to wait. Next slide. Currently, 988 routes to the crisis center based on your area code. 988 does not receive your geolocation. Next slide. So an example of this is I used to live in Pittsburgh, Pennsylvania. My area code was from my hometown in the Bay Area. And if I was having a crisis in Pittsburgh and I called 988 from Pittsburgh, my call would be sent to a crisis center in California. Next slide. I recognize balancing privacy and location with 988. accesSOS is for people who need help now. We ask for permission to share location. And when they opt in, we share location. Next slide. We recognize that our app is only one modality, and that's a limitation. We strongly urge this community to make all forms of modalities accessible, whether it's text, chat, video, or a call, 24/7, 365. On these calls, we discuss that our goal is for someone that is in crisis to have someone to talk to, someone to respond, and somewhere to go. accesSOS advocates that those responding are trained in their preferred language and ideally have lived experience. Next slide. Our vision is within the next 12 months, we incorporate 988 routing into our app, have it deployed nationwide, and translated in 12 languages. Next slide. And before I close, I really want to thank my team. We're women in STEM. We come from the communities we're serving, and we understand what it's like to be left out because of a disability. Next slide. Our team is passionate about making sure all people have access to emergency help. And next slide. accesSOS is powered by incredible supporters, which makes our app free for anyone to use. We believe in impact first and saving the lives of human beings who are marginalized, over-policed, and underserved. Next slide. And so how can you help us? We want to learn from you. We're looking for folks who have worked in crisis call taking and honestly just want feedback from you. Visit the link in the chat and send us your information or email us at hello@accessos.io. We invite you to join our mission to be the trusted go-to emergency app and support a cause core to our belief that the right person is there at your worst moment. And Eileen, my teammate, dropped a link in the chat. Please, we just want feedback from you. And thank you so much for your time. I welcome any questions.
Gabriella, thank you so much for sharing this incredible work. I think I am in awe and stunned by the fact that you all are working on this and making it available free to individuals to use. And I think speaks to the mission that's driving the work. And just impressed by the impact that this is having and will have on the goal of access for all and police diversion as well. So really, really appreciate that. I want to invite our three experts to join us in a roundtable discussion and reflect a little bit on what Gabriella shared. So Tansy, Jason, and Olivia, thank you guys for joining for this. Tansy, would love to turn it to you first, just for any reflections on the incredible work, the app that Gabriella shared with us.
Yes, thank you. Gabriella, amazing. I've told you this before. You're amazing. This is much needed work. And I'm grateful that, that you, someone with lived experience, someone who experiences this personally, was able to pull your professional knowledge into this space to develop the solution. So I think one thing I wanted to highlight is the fact that you are someone who has a lived experience, that you're creating solutions based on that experience and of those around you. You're constantly asking for feedback, constantly asking for insight, particularly on sharing the location, getting information about the location, and also asking where they're located. Like, are you calling from California or are you actually in Pennsylvania? These type of things matter. And it matters for us in the 90-day space to make sure that as we're getting funding at the state levels, that we include people with lived experiences. We include those in community response because they are in the communities doing this work already, and that they're able to access that funding from 90-day at the national level. So thank you, Gabriella. Thank you, accesSOS. You guys are doing amazing, amazing work.
Jason, what about your reflections kind of from where you sit at Trek Medics International? How do you see this work that Gabriella is doing fitting into the broader landscape?
Yeah, thank you so much. And really hats off, Gabriella. The progress you're making is incredible. As a paramedic, I can tell you that what she's referring to is a very real problem, that when I would respond to emergencies, if the patient was deaf or hard of hearing, we were kind of like a deer in headlights, didn't know what to do and how are we going to resolve this, trying to find a way to think on our feet. But I think there's such an important thing about 988 in general, but the second part of someone to respond, the opportunity right now for organizations to get involved and to be able to respond, and the enabling technology that Gabriella is putting out there, so that when people do have specific needs, the right lived experience responders are available to go there, because paramedics, police, firefighters, as we all know, they have a limited amount of training, and you just can't cover everything that everybody's going to call for. So this is just a huge step in the right direction.
And I think goes back to the quote of the day too, right? Is that we need to make it accessible to all, and not only sort of the call for services, how do we get the services, but once the services respond, making sure that they are prepared and trained and situated to help the individual in need. Olivia, would love your reflections as well on this solution.
Yes, thank you. Thank you, and hello. And as a deaf person myself, I would like to thank Gabriella for this amazing resource. This would create a difference and more for access for a person who is deaf and hard of hearing, and to provide that accommodation. First is accessibility, then accommodation, there's communication. These three things are so essential to deaf and hard of hearing people in the community. And when they are left out of that, how are we able to make sure that they and their needs met in a time of crisis? And how can we ensure that they are safe? And how do we know where they are located? It doesn't matter if it's a 911 or a 988. Gabriella's resource is amazing. And to be specific on their needs and get their needs met, and be able to direct the resources, whether it be a 911 situation or behavioral health in a 988. So it's important to think about our deaf and hard of hearing community and to get a higher percentage of what the language that they use, whether it be American Sign Language or another language that is not English. So we have to make sure that we can text 988 now, which is amazing. Yes, however, we need to keep in mind that we may not be able to get complete understanding from English text. So we need to apply this if our accessibility is met, whether that be a visual language like American Sign Language. So we have to make sure that we can create an opening for that accessibility for these individuals and feel strong in that. And how we have that accesSOS. So it's really wonderful, and I'm happy that we have that resource. Thank you so much, Gabriella, and your team. Thank you.
Thank you, Olivia. And there's some comments in the chat around kind of the importance of receiving text in multiple languages being a critical piece as well, as we think about accessibility. And then a question in the chat as well that I think is more for Samsa. So maybe I'll save this for Richard when we get to him. But asking if there's a plan for Samsa to set up 988 and crisis line for ASL users similar to the disaster distress helpline. So I don't know if Richard is on and wants to weigh in on that now, or we can save that to a little bit later. But a good question.
Well, I am on, so I can speak, quickly. We are very much alert to the fact that the existing system is not complete, in a number of different ways. For example, you do Spanish language text, for example. So we are continuing to work to expand this, and we are hopeful with additional funding to be able to make the system more complete. We've been working closely with deaf leads around these issues, as well as others. So it is on our radar. We do have a commitment to try to expand access for all populations in as many languages as we can. We know, for example, when you call, there's a Spanish language subnetwork, but there are many other languages that are available through an interpreter service, but an interpreter service is not ideal in crisis. So we are aware that we are only partway in the development, and that we need to be paying attention to the needs of a variety of different populations. So this has been I love the app, love the way it works. Really glad to learn about this.
And Gabriella, I just was really struck in your presentation by the statistic that 70% of 911 call centers can't get text. And I, gonna totally be honest about my ignorance of that. How are you guys kind of getting the word out about this huge gap in our emergency response system to policymakers, to others?
Yeah, so we are part of a coalition, deaf and hard of hearing coalition that advocates for this. And so in the coalition, there's the National Association for the Deaf, NAD, and they advocate policy-wise. They discuss with policymakers and the FCC, but it's a really just the 911 and texting is a really fragmented state right now, because different municipalities and cities and counties, frankly, just have different sources of funding, and some of them don't even have the resources to implement it. So it's a policy level issue, but it's also a funding and resources level issue.
Got it. Yeah. Well, and again, what an incredible way you all are bridging the gap through your app, right? Through an accessible app to folks. And I see lots of interest in getting more information and following up. So I think folks appreciate the link, the requests that you all put out there for feedback. Really just incredible work that you all are doing, Gabriella, and making crisis services and other emergency response services more accessible to all. So thank you so much for coming and sharing with the group today. All right, let's move into our into the trivia hot seat. And we wanted to flag again that this is one of the 2 ways that you can get one of the 988 t-shirts, either in English or Spanish, and with one of 5 quotes on it as well. So by joining the crisis hot seat or the trivia hot seat, that's how you can get a shirt, or you can buy it on the Crisis Now website. So we got a volunteer for today's hot seat. So I'm pleased to invite Shawnee Medina to join us. And please correct me if I got your pronunciation of your name wrong, but thank you for jumping in on the fly for today's trivia hot seat.
No, thank you so much for having me. Yeah, it's pronounced Shawnee. I'm with Mental Health America National, and I'm a policy intern this summer, and it's just been really exciting to join in on these weekly meetings.
Awesome. All right. Well, here's the context for today's trivia hot seat question. We wanted to focus a little bit on some of the history and context that's led us to where we are today. And one of the key issues that's come up is around how to support individuals who call and who are at imminent risk of suicide. So the Lifeline implemented a policy back in 2012, specifically to support callers who are at imminent risk of suicide. And the need for this type of policy has been highlighted in research by Gould, Calafat, and Mishara, who are reviewing crisis calls. And the specific question for today is this policy prioritize blank with callers and outlined the risks, outlined the risks of rescue without consent. So either the policy prioritized A, active engagement, it prioritized B, collaborative problem solving with the individual. It prioritized C, appropriate self-disclosures from the individual calling, or D, it prioritized all of the above. So again, this is the policy focused on callers at imminent risk of suicide. So I know we have a trivia hot seat question out to the audience to help you out, Shawnee. So we'll see what folks have to say. And you can get help in the chat too. All right, so here is what the audience has to say. Shawnee, do you agree or want to diverge from the sense of the group?
I'm gonna go with all of the above.
That is right. And I know it could have been a trick question because there were some questions around self-disclosures and whether that's part of it, but the answer is D, all of the above is part of that policy. And I know we have John Draper joining us next week to share a little bit more about that approach. And John, I don't know if you're on now and just want to give a quick preview of what you're planning to talk about next week with this group.
I'm happy to do that, Lindsay. With all the misinformation and rumors that are milling about around the 2-3-digit numbers beginning with 9, the most important distinction between calling 911 or 988 begins with the training of counselors who are answering those calls. So talking with a person who's thinking about suicide when you're a hotline counselor is very different than talking with a person who's thinking about suicide who's in your office. And they could have immediate access to lethal means and use it during your conversation. They could be in a car driving fast. They could be standing next to a window in a high-rise building or holding a firearm or a bottle of pills. And all you have are your words to help prevent them from killing themselves. So what do? That's what this policy was really intended to do, is to help our crisis counselors in a standardized way address these very, very imminent risk situations in the moment. But what does imminent risk mean? What does it look like? And if they're at risk, how do you help get them to that safe place? And And if you need someone to check on the person to keep them safe, when do you call 911? And under what circumstances should you be using alternatives to contacting 911? And if you have to contact 911, is there some way to make that less traumatic? And how do you even know what happened? These are the kinds of questions that the Lifeline policy for helping callers at imminent risk of suicide was really set up to do. So next week, we're going to talk about how that's been going since we actually began implementing it in 2011, what we've learned about it, and where we're going with it in the era of 988 as we get more people contacting us who are in mental health and suicidal crisis. So looking forward to seeing you all next week and unpacking all of that.
Thanks, John. Certainly no small thing to contemplate or to unpack in our conversation. So looking forward to digging deeper next week. And thank you to Shanae for being in the trivia hot seat, and congrats on your 988 t-shirt that we'll get your way. Karen, I'll get you hooked up. So we're going to shift to the crisis talk. Stephanie Hepburn is on a much deserved vacation this week. So I will be teeing up a brief conversation with Shanna Palmieri. Shanna, you spoke to Stephanie in the recent article about the tech platform that you have created, your organization has created to help connect people who are in the emergency department to inpatient care, and to help alleviate some of the pressure on the workforce in the ED. Can you tell us a little bit about the story of how you came to creating this solution, and how you see it helping support the broader needs of the community?
Absolutely, thank you. I was working to develop a crisis team for our psychiatric patients in our emergency department. And in running that team, it became very apparent to me how long the patients who were in a mental health crisis were waiting in order to be transferred to an appropriate level of care. And that could have been anywhere along the continuum. And also that one of the things that often happened was that patients would be transferred to the highest level of care because the time to get an appropriate appointment or care at a partial hospital or day treatment or crisis center took too long. And so we were also overutilizing the highest level of care. And that our staff just didn't have an easy way to identify which behavioral health facilities had which specialty clinical programs. So where was the geriatric psychiatry unit? Where was the program with ECT? And so we're just keeping these manual lists. And so really became a mission to connect with the technology folks within the hospital. And then we went on to develop the platform, which is a nationwide behavioral health transfer network at this point. And so it is all along the continuum of care. And we work with everybody from first responders to mobile crisis teams in communities to emergency departments, that when they're interacting with a patient, they no longer need to know what the resources are, where they're at. They just need to know their patient, and then they'll get connected and they can electronically communicate and send requests out to multiple facilities or programs at the same time to see who has availability and who can accept their patient, driving down times to prevent the risk levels of the patients who they're with, and also to save a lot of time for those clinicians who can get back to the clinical intervention work with the client rather than being engaging in all of those manual tasks to find those treatment resources.
That's great. You know, I, from my personal experience, remember sitting with a family member in the ED who was waiting for, you know, the hospital to call around and figure out where they could get a placement, and just how long that took. And I think that experience with my family member was probably a relatively easy one compared to what some people experience when they're sitting in the ED for days or longer waiting to get connected to care. One quick follow-up question. You may have mentioned this. Does your solution sort of connect folks only to inpatient care or to community-based care as well, if the individual maybe doesn't need that higher level of treatment?
We do connect individuals to the entire continuum of care. So community-based care, community-based mental health centers, day treatment programs, partial hospitalization, substance use disorder programs, inpatient crisis.
Can you repeat the question?
Mm-hmm. So all along the continuum of care, clients can be connected. So the clinician can search and find by level of care and treatment type to clinically match, and then they can communicate and beacon requests out to any of those receiving facilities.
That's great. And what's the response been from providers who are using this app?
Yeah, we actually work with a number of mobile crisis teams throughout the state of Texas right now, and have had an incredible response from them using this, because they work in the community, they work on behalf of hospitals, they go into schools, they go into jails, and now they can use the mobile app to find the resources, sometimes diverting the patient from going to the ER at all. They can go directly into the crisis program that they need. But when we look at response times for medical patients, it happens fast because it's considered an emergency. And part of the mission is that behavioral health crises are considered the same way. And so when we work with these mobile crisis teams, the response time now, when they put a request in, it could go out to 15 to 30 behavioral health hospitals at the same time. And within 2 minutes, less than 2 minutes, they have received a response from all of those hospitals, letting them know who could potentially take that patient. And as the app uses geolocation as well, so they can geolocate to the patient's home address, to where they're at currently. And so they're saving hours and hours and hours of time, of their own time, and also of the patient's wait time, by being able to use a technology rather than a manual process.
And I imagine the app, the provider at the ED or the crisis response team provides a good bit of information about that individual, right? To see if it's the right fit for the inpatient facility or other provider to serve them. Is that a good assessment?
Absolutely. The app also contains clinical document sharing. So they can upload their entire clinical assessment labs. They can use either a camera feature or an upload feature and put the involuntary order in. So all of the clinical documentation that today may be sent through a fax machine is attached to the patient's transfer record in the app. And it's all HIPAA compliant and secure for the PHI. And so they can direct message with each other. They can share clinical documentation, go through status steps.
Oops, I think we accidentally muted you.
Sorry. They're able through the platform to be able to share all that clinical document in real time rather than using fax. Yes. Mm-hmm.
Great. We can go to the next slide. I don't know what's going on with the slide. We got some drawing on it there. Shanna, I thank you for sharing, and would encourage folks to check out the app. Or to check out the Crisis Now article that provides more detail about the app, the platform that she was describing. So thank you so much for taking the time and for all the great work that you're doing to help connect folks to treatment, and again, alleviate some of the burden that we know is very deeply felt among the workforce right now. So thank you.
Great, thank you.
All right, we can go to the next slide. We have a new segment on these weekly calls that we're really excited to share. One of our goals here is to feature individuals who have lived experience, right? That is the goal as we think about crisis services, to center the voices of individuals with lived experience in our work. So we know as 988 is now launched and live, that we're really kind of at the base camp of Everest, right? We've put in a lot of work to climb to where we are today, metaphorically speaking, but we still have a large climb ahead of us. And I know Samsa has talked a lot about sort of the next steps of kind of building the capacity of the crisis centers, thinking about mobile crisis response teams, and making sure that there's someone to respond to every call where it's needed. And then, building that stabilization place, a place for people to go who need a little bit more treatment stabilization. So clearly we're sort of at the ground level in some ways, and have a long way to go. So in this segment, we're really focused on hearing from individuals with lived experience about what is it going to look like to realize that vision, to get to the top of Everest in building our crisis response system. So I'm thrilled to turn to Steve Hammerdinger to answer that question for us, to share from his perspective, how do we fulfill that vision of 988 from the lens of an individual with lived experience? So Steve?
Thank you so much. First of all, I'm very impressed with accesSOS, that app. Also, I am impressed with the planning and the organization and work that has been involved to assist deaf people at NAD and 988. And it's all truly a base camp. And it assists people to get to the top of the mountain, to the top of Everest, with all that work and all those challenges for deaf individuals to have, like myself, to have that access, and who maybe have never been able to connect with 988. And then a large concern that I have is looking at these three things: someone to contact, someone to call, who will respond to the place that is necessary into wherever that person is located. Some states, especially states with state organizations for the deaf of mental health services. And we've discussed on how to create the last two of the three that I mentioned, to provide access to the individual who's calling, and to have concern about the other states that do not have that. So it is a challenge indeed. And a mobile team is not as prepared as John's comment said to be specific enough for the individual who needs it when you show up on scene and find your patient who is deaf. And then you are that deer in the headlights. They don't have the training for that mobile team to find that, to provide services to that individual who is deaf or hard of hearing. So, and how do you find the individual who is going to be able to assist that person, and to find a place for that person to go? So we need to listen to people who do have the language line and can provide interpreting services, and then go and see the interpreting services that are there, whether they have video remote interpreting services or a live interpreter, or they have other interpreting services for people who need it. So that is a situation where you need these resources in place. And so you can send the patient to where they are best needed, or excuse me, where they are best served. So that's one way to climb to the top of the mountain.
Thank you, Steve. So well said. I think about the work happening in Medicaid to build mobile crisis services, and the fact that it's very generic still right now. Like, we've had some conversations about children, specifically in that mobile crisis response, but we have to think about other needs of individuals as well, as we think about each piece of the continuum, right? Making sure that it is responsive to all of the individuals who will be served by that service and their special particular needs, and putting the individual at the center of that design and development of those services is absolutely critical. So thank you so much. So we'll be having more segments like that in the future, again, to highlight lived experience and to answer that question of how we get to the realized vision of 988, because we know we've got a long way to go. We've come a long way, but we've got a long way to go to build out the system as a country. So I want to turn next to the Samsa update. And Richard, I know you're joining us today to share some key insight, and thank you for already chiming in earlier, but I'll turn it to you for this update.
Thank you very much. As always, a pleasure to be here. So let me mention a number of things. We have, of course, have been closely monitoring the utilization of 988 and the National Suicide Prevention Lifeline as a whole, because of course the 10-digit number still works and calls still come in on that number. But as we expected, volume is up, calls, chats, and texts, and they are being answered at the highest rates that we have seen in our history. And I think it's really important to emphasize that because of the recent investments that have been made, hundreds of people who are currently suicidal are being responded to each and every day. So we have already accomplished a huge amount. And of course, we're working on working with stakeholders, getting the word out around 988, and working with all of our partners. 988 was a major feature earlier this week at the NASHPD meetings. It was a major topic of conversation on Monday of the National Action Alliance for Suicide Prevention's Executive Committee. And as you know, there are over 200 organizations participating in the National Action Alliance. Last week, I was in Colorado to speak to the National Association of Counties about 988, where again, there's a tremendous amount of excitement and desire to improve our crisis systems on the local level. And I love the visual of the mountain because 988 is a really important step up the mountain, but we're certainly not at the pinnacle yet. And we need the other services to be available across the country, like mobile crisis, like crisis receiving and stabilization. Actually, just within the last 48 hours, Samsa's, what we refer to as our mobile crisis funding opportunity closed, but the name of it is actually Innovative Community Crisis Partnerships. And that's what we're aiming for. Innovative community crisis partnerships between 988 and 911, between 988 and law enforcement, between 988 and emergency medical services, and the critical role that mobile crisis plays there for those people who need someone to come because talking to somebody on the phone is not sufficient to meet what their needs are. So we are really excited about that. We're also excited that we are continuing to build out our teams. I wanted to mention to you actually two recent hires, one in the 988 office, Tiffany Russell. And I don't believe Tiffany is on this call, but she actually gave a presentation on the Crisis Jam from her previous position, looking at 988-911 collaboration with the Pew Foundation. And she'll be working on criminal justice initiatives as well as 988-911 coordination. I also wanted to introduce Johari Elegant, who is now part of the suicide prevention branch and who ran the Lifeline Center in Washington, D.C., as well as she also oversaw a 911 diversion program in Washington, D.C. Johari, can you hop on and say hello?
I sure can. Thank you, Richard. Hello again. My name is Johari Elegant. As Richard just said in his introduction, coming from the DC Department of Behavioral Health, overseeing their Access Helpline, which handle a number of functions, but most importantly, the National Suicide Prevention Lifeline. So been involved in work in that for several years, and of course, involved in the planning and implementation of 988 there. And at the same time, and fortunately so, a 911 call diversion pilot. So I think it was really beneficial to have those two efforts going on at the same time so that we could think about ways to integrate both and make sure that the district residents were receiving the best care and diverting from law enforcement if it was necessary to divert to crisis services. So happy to be here and to continue these efforts. Thank you.
Thank you, Johari, and thank you very much to the Crisis Jam for letting us do our Samsa update.
And Richard, we got a couple questions in the chat. I'll see if you have any thoughts on them now, or we can always circle back to them. The first question was from Mary Giliberti about the guidance that I think you guys are working on around children's crisis, and any update you can provide around when that might be coming.
I do not have an update on that. I will check with Dr. Everett and Melinda Baldwin, who have been the leads on that. I also see there are a number of questions about the imminent risk policy and wanting to link to it. And what I would suggest is that Vibrant will be releasing shortly their revised policy, same basic principles, but it is being updated. That's probably the one you want to link to. And I believe John Draper can correct me, but I think it's going to be associated with, or at least quickly following next week's Crisis Jam when it's being presented.
That's great. And then one other question here in the chat, and this may be for you, Richard, or maybe something we can circle back with the broader community on. An individual was asking if there's any sort of communications or ASL videos explaining 988, or if that's something that's in development by Samsa or someone else as material to help the deaf community sort of understand this new crisis line.
That's a great question. I don't know the answer to that. I'm not aware of it. That doesn't mean it doesn't exist, but if we haven't done it, we should. So I will be communicating that.
Great. And then I think the last question was whether you have any additional data that can be shared around the increased call volume and response, in addition to the statement you made that we've seen that volume increase.
Yeah. So I mean, I think we will be releasing information on data. What we've looked at is what's the best time period to utilize, for that is, a day, a week, a month, because we know that there can be variations and trends depending on how you look at that. So what we're hoping to do is to be able to look at that data on a month-to-month basis, right? So, we're happy to have individual conversations, but I think in terms of publicly releasing, volume data, we're wanting to get a block of time that would be reasonable and subject to less variation than, for example, a day would be.
Yeah, particularly when we're looking at the first couple of weeks here of 988 going live, we know there's going to be lots of variation for sure.
Yes, that's exactly right.
Great. Well, thank you so much, Richard, and looking forward to future updates as we continue to get that data and have a bigger or a better picture of how that volume and response has been going. So thank you so much for sharing. All right, I'm going to turn it next to Brian Hepburn at NASHPID for some quick updates. Brian.
Thank you, Lindsay, and thank you for your good work and coordination. As several people have mentioned, this week was our annual meeting. It was so nice to see people in person. One of the big concerns was about workforce, and I really enjoyed listening to Gabriella Wong and to Shauna Palmieri talking about these apps, because the more we can do with technology to save workforce time, the more we can eat into that workforce problem. Both apps very impressive, and I was happy to hear from Shauna that they're connecting to the full continuum rather than just high-level services. That's great. At our annual meeting, we were celebrating the 988 kickoff, and there was a big shout out to Richard McKeon for all the work that he's done on suicide prevention and the lead up to the work on crisis services in 988. So thank you, Richard, for all your good work. At our annual meeting, there were presentations on our new papers, and we'll try and get those new papers out to this audience fairly soon. We'll give you links where you can go and get them. Also, we'll have links to our other presentations that where they may not be related to the papers. I did want to highlight two of the presentations. One was it started us off on Sunday morning, and the speaker was Rowan Willis Powell. If you haven't heard Rowan, she's a fantastic speaker. She was previously with On Our Own of Maryland. Now she's with Youth Move. And she talked about choice and voice, how youth voice, autonomy, and persistence created a leader. And then on Monday morning, the presentation was the presentation that kicked off the day was Empowering the Roles of Lived Experience by Amy Brinkley and Justin Volpe. Another great presentation. So we were very fortunate. We had a lot of good socializing and a lot of good presentations, nice mixture of hard work and hard play. So thank you very much.
Fantastic. Thank you so much, Brian. Here's a picture from that 988 celebration event, which was just incredible energy in the room. So thanks for hosting, Brian.
Thank you, Lindsay.
Awesome. Just a couple of quick updates as we come towards the top of the hour here. Want to remind everybody that the official trailer is now available for Moving America's Soul on Suicide. So encourage you to check that out. Second, want to just preview what's coming up next on our Crisis Jam. As we already mentioned, Dr. John Draper is joining us next week to talk about that policy around engaging callers who are at imminent risk of suicide. But also wanted to flag in 2 weeks on August 10th, we'll be joined by two folks who are going to talk about Arizona's 988 roadmap and caller survey. So Justin and Rachel. And Justin and the Arizona team from Solari, the call center in Oklahoma, in Arizona, are now in Oklahoma. And they're going to actually share some quick anecdotes from some of the calls they've gotten from 988 during those first 2 weeks. So we don't want to miss that conversation as well. So make sure you mark your calendars and plan to join us. The last thing I wanted to mention is that you all know these 988 Crisis Jam calls are open to everyone, and that's a signature value of these conversations. But we recognize that today we had a little bit of disruptive behavior for the first time from some folks who were calling in. So I know the team is going to be taking a look at how we can continue to both make these calls open and engaging for everyone, but also kind of protect our conversations from disruptive behavior. So thanks for bearing with us with that today as well. So with that, I will thank you all for joining us. Thanks for having me again as host for today's conversation, and a huge thank you to Gabriella Wong for sharing today about the incredible tech platform and solution that she and the organization are leading at accesSOS. So thank you guys so much. Hope you have a great rest of your week, and we'll see you back here, same time, same place. Thanks so much. Bye.